أول حاجة basically we're gonna be starting by naming the cranial nerves really quickly, just going through the names of them, and in the olfactory nerve, which is the first one, بعد ذاك الأوپتيك, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory hypoglossal. Obviously, this is like the basic, most important thing. You need to always know the names of the cranial nerves and their numbers. It's basically a given. بعد ذاك, what's really important, and the most area of questions usually, is the cranial nerve component. And if you were to summarize the questions that they ask you to cranial nerve, they could ask you about the name or the component, or usually a test and lesion. لكن usually التست marks قالوا لنا كتير هنقوم نقول lesion. So a name, obviously a cranial nerve number مع النيم حقه. A component, which is basically هنتكلم عنه بعد شوية, which is basically what is it sensory, is it motor, and so on الكلام ده. A lesions, which are basically what happens when a nerve has a damage to the nerve. تاني ممكن يسألوك برضو من البرين كم level, يعني هو جاي من البومز ولا جاي من المظلة ولا جاي من الميد برين أو كده. ممكن برضو يسألوك من النيوكلياي, ودي بالذات في حتتين هقولهم later on are very important, اللي هم الفيشال nerve أو الفيجاس nerve. It's very important to know the cranial nerve nuclei فيهم. So basically ده الحاجات المهمة شديد, يعني component والنيم, brainstem level والnuclei والlesion. أهم حاجات طبعا هيكون عندنا lesion والcomponent. They're الاثنين they're the most important بجد. طيب. Okay, so basically let's explain the concept of a component. الcomponents الidea حقتهم إنه إحنا we summarize what a nerve does by explaining هي بتعمل شنو. So عندنا أول حاجة عندنا الديفيجن الأول whether it's sensory or motor. So it's afferent or efferent. يكون afferent يكون efferent. If it's afferent, it's sensory, معناتها it's going to the brain. If it's efferent, معناتها it's motor and it's coming from the brain. تمام؟ It's pretty much a simple idea. بعد ذاك عندنا somatic وvisual. يلا somatic وvisual ديل it's divided based on somatic being إنه it supplies the skeletal muscle or the skin وكده. So areas where it's voluntary. Skeletal muscles معاها skin. And visual is areas of smooth muscles or cardiac muscles, glands, or pharyngeal arch derivatives. تمام؟ فإن smooth muscles or cardiac muscles or glands are areas that you can't understand it or feel it or control it. So it's involuntary. So كده بنسميها visual. ثاني عندنا pharyngeal arch derivatives there, they're basically embryologically coming from a special area in head and neck اسمه pharyngeal arches. The pharyngeal arches there هم there 6 arches بدون specific specific organs وmuscles وكده. دي احنا even though they're skeletal muscles بنعتبرهم visual. تمام؟ So although they're skeletal muscles we consider them as visual. So it's either تكون smooth cardiac gland أو تكون pharyngeal arch derivative of skeletal muscles. So it's very important to memorize the pharyngeal arch derivative from both a neuroanatomy point of view and an embryology point of view. I mean repetition. طيب يلا لما نيجي نتكلم عن special senses, we always consider the eye and the ear as somatic, one nose and mouth as visual. It makes no sense, but it's كده يعني. Try to memorize it. إنه دائما لما special senses, الeye والear بنسميهم somatic, والnose والmouth بنسميهم visual. The way I usually remember it is إنه الnose والmouth ماشيين into the internal organs. هيخشوا في internal organs, so they count as visual. So a nose is part of the respiratory system, والmouth is part of the GIT, وبنقوم بنسميهم visual. الeye والاير بنعتبرهم somatic. So far good? تمام. So آخر حاجة فضل لنا general والspecial. يلا general والspecial ديل it depends on the type of sensation itself. يعني السensation حقنا ده can it be transmitted by normal nerves a normal spinal nerve ولا لا. يعني if a sensation can be carried by a spinal nerve يعني pain, touch, temperature بنسموه general. لكن when it can't be carried by a normal nerve لازم يكون carried by cranial nerve بنسميه special. يعني السبيشال ديل حاجات only the cranial nerve can do it، في حين ال general أي nerve in the body can do it. تمام؟ يلا based on this division هنقوم نقسمهم، يعني هتكون يا afferent أو efferent، يا somatic أو visual، يا general أو special. فهيبقى عندنا a combination of 3 words يطلعوا لنا اسمه حاجة بنسميها components. يعني component is a combination of 3 of those definitions عشان تشرح لنا the function of the nerve. So عندنا أول واحدة هنبدأ هي general somatic afferent. So مين اسمها نترجمها؟ general معناتها sensation that can be understood by both the cranial nerve and the spinal nerve. تمام؟ somatic معناتها it's from the skeletal muscles and the skin. afferent معناتها it's sensory معرفش ليه البرين، صح؟ هنقوم نفهمها. معناتها لو afferent هتبقى sensation، عشان هي general معناتها it's general sensation with touch, pain, temperature, proprioception, and so on. And since it's somatic معناتها ما هتكون من الintestines، ما هتكون من الheart، هتكون from the rest of the body. تمام؟ So in other words, it's any nerve that carries general sensation from the body to the brain. يلا عندنا فيها example. عندنا a fifth which is the trigeminal. It's gonna carry normal sensation زي مثلا ال sensation of a touch pain temperature from the face. عندنا الfacial number 7. It carries normal sensation from parts of the ear, for example. Glossopharyngeal, it takes normal sensation from the tongue. Vagus takes sensation برضه from the external ear, and so on. يعني لو بعد شوية هنحاول نفكر في كل واحدة and what the functions of the nerve are عشان نقدر نمرق منها components. But basically, the idea of the general somatic afferent is it takes sensation عادي that any other nerve can take دي general somatic afferent. تمام؟ طيب يلا عندنا بعد ذاك general somatic efferent which is the complete opposite. يعني it's general so it's a normal sensation. It's somatic, so it's for a muscle. It's not pharyngeal derivative. Skeletal muscle ما pharyngeal. And it's efferent معناتها it's motor. So هيكون motor innervation في skeletal muscle. skeletal muscle ده non-pharyngeal. تمام؟ يعني ما ممكن لأنه pharyngeal قلنا هنعتبرهم visual، صح؟ فديل skeletal muscles non-pharyngeal. عندنا منهم 4. أول حاجة extraocular muscles اللي هم cranial nerve number 3, 4 and 6. They're regular muscles. They're motor عاديين ما فيهم حاجة. So it's general somatic efferent. عندنا برضو ال 12 hypoglossal muscle. Hypoglossal nerve. It supplies the tongue with normal motor innervation. So it counts as a general somatic efferent. تمام؟ It's very easy to memorize. إنه ال extraocular muscles والtongue are the only muscles بتودي لهم cranial nerves general somatic efferent which is the normal innervation. It's a normal nerve. يلا كنت من general somatic which is basically general sensation جاية من body من ال skeletal muscles in the skin. عندنا والله الفيزرال. الفيزرال ده احنا قلنا بتيجي من الفيزرال itself, so it's either a muscle from a smooth muscle, a cardiac muscle, or a gland. تمام؟ So smooth muscle, cardiac muscle, gland دي هنسميها فيزرال. ممكن برضه تكون skeletal, pharyngeal origin. عندنا general معناتها it's حاجة normal زي باقي البودي. So it's something that can be carried by a normal nerve. في نفس الوقت afferent. تمام؟ So it has to be a sensation that's carried by other nerves as well. لكن it's from a visual origin يعني من ما من ال somatic origin. Make sense؟ يعني it has to be coming from um, blood vessels, smooth muscles and so on. فيلا عندنا هنا فيهم الجلوسopharyngeal والvagus. Specifically for glosopharyngeal والvagus you can compare it to the compare it to الباروreceptors, الchemoreceptors, الحاجات دي. تمام؟ So like from a blood vessel, from a viscera, from glands back to the brain. So it's signals to the brain from the viscera, from the blood vessels on the glands. هتكون عندنا glosopharyngeal والvagus nerves بس الباقيات كلهم they can't do it. And it's general لأنه other nerves, spinal nerves can also carry the impulses دي. بعدها قلنا general visual efferent which is the other way around. يعني it's a general sensation that other nerves can carry as well. لكن to the visual it's efferent, it's motor. في الحالة دي general visual efferent is just another word for parasympathetic. So it carries parasympathetic innervation. عشان كده هنقول general لأنه في other nerves can carry parasympathetic صح؟ So it's a general sensation. So it's visceral لأنه it's for the visceral. It's nothing you can control. So it's efferent and it's motor. So the parasympathetic innervation to the smooth muscles and glands ده بيعمل له control الجنرال visual event. And it's very important to take into consideration إنه GVED is only pre-ganglionic. يعني لما الحاجة post ganglionic عندها another cranial nerve you don't count that as it. يعني you only count the pre-ganglionic. يعني for example we take an example of إنه إحنا عندنا third cranial nerve دي اللي هي الأوكيلوموتر. الأوكيلوموتر هتيجي شايلة parasympathetic innervation from the nucleus to الجلاند. تمام؟ هتوديها للسيريوري muscles. تمام؟ يلا عايز تعمل الحاجة دي للآي it's not gonna go directly, it's gonna have to synapse صح؟ بتعمل post ganglionic nerve. يلا post ganglionic دي it's part of a trigeminal nerve. Number 5. لكن it doesn't count as general visual efferent. حاجة very important to take into consideration إنه general visual efferent is only talking about the pre-ganglionic innervation ما post ganglionic. تمام؟ طيب ليش عشان كمان general sensations. General sensations is sensations that you can feel from other nerves. إحنا قلنا في any motor sensation you can feel normally ولا parasympathetic ولا touch pain temperature والحاجات دي. Special are sensations that other nerves can't feel. So it's usually a special sense. So afferent, special afferent is a special sense. So taste, vision, hearing الحاجات دي. بعدها كان في عندنا السوماتيك وفيجوال. قلنا إن السوماتيك هو الإير والآي والفيجوال هو الماوث والنوز. So special somatic afferent يعني special sense that is sensation. So it's afferent from a somatic, which is the eye and the ear. So it includes two nerves, the optic and the vestibulocochlear. So 2 and 8. A special visual afferent هتكون it's the same idea except لأنه هو visual ما somatic هيكون عندنا nose والmouth. So it's any special sense from a nose and the mouth. Tongue. So a nose والtongue. عندنا للnose it's the olfactory nerve which is 1. للtongue اللي هو taste sensation عندنا 3. عندنا facial nerve اللي هي cordus tympani from the anterior 2/3 of the tongue. عندنا الninth الglosopharyngeal بتشيل posterior 1/3. عندنا vagus nerve which takes sensation from the vallecula. So عندنا 3 في الtaste. 7 و9 و10 3 contribute to the taste. والnose it's number 1. تمام؟ خبر ثاني special visual efferent. والspecial visual efferent هي it's gonna take a special sense so حاجة ما normal اللي هي pharyngeal arch origin. دي الحاجة special about it إنه it's pharyngeal arch. Visceral although احنا قلنا it's skeletal muscle لكن هنعتبرها visceral في pharyngeal arch organ efferent يعني it's motor. So it's motor innervation to skeletal muscles from pharyngeal arch organ. ودي it's a bit difficult يعني to translate براك يعني if you're trying في الامتحان or something to solve them by understanding, but a special visual efferent is a bit tricky. So it's kind of against the rules in that it's a skeletal muscle that's visual in that it's special although it's a muscle which is the pharyngeal arch organ. عشان كده try to memorize it إنه دايما when you think of special visual efferent you're thinking the pharyngeal arch. المسلز that supply nerves that supply pharyngeal arch organ are fifth one, seventh, ninth, and 1975. So five, which is trigeminal, facial, glossopharyngeal, and vagus. They're الأربعة they supply pharyngeal arches. We're going to talk a bit more in details اللي قدام about them.